Americans consume more goods and services today than ever before. Because of this, Americans like to think of ourselves as smart and savvy consumers. It can be assumed that usually the more money spent on a service or good guarantees that the service or good will be of higher quality. While this is true for most products, the largest and most expensive American expenditure is quite different. According to the textbook, Healthcare Delivery in the United States, healthcare expenditures account for up to 18% of our gross domestic product. This means that 1/5 of the United States economy is supported by healthcare expenditure. And while we have the most expensive healthcare system in the world, we have lower and poorer health outcomes than any other country, any other comparable country. In fact, the United States has the shortest life expectancy and the highest rates of pregnancy-related mortality, according to Peterson-Kaiser HealthSymptomTracker.com. This leaves many Americans wondering why we are paying so much for far worse health outcomes, when the real question to ask is, why is healthcare so expensive in the first place? The reason that healthcare is so expensive is due to a variety of factors, but the most important is that the United States healthcare system is focused on reactive care and does not do enough to address out-of-pocket costs for patients. According to a study by Dr. Jennifer M. Tabor, 24.1% of people that she surveyed in her survey participants did not seek medical care due to high costs of medical services, including patients that suspected their medical care may be necessary for their immediate health. Because of this, many patients put off care until it is extremely necessary, driving healthcare costs up for everyone. Additionally, high costs of medicines used to treat manageable diseases will affect overall health outcomes as well. According to the National Library of Medicine, a study was done to analyze 160 articles that studied drug adherence and cost analysis. And these articles concluded that 85% of the articles reviewed showed that patients who were subjected to increasing medicine costs had significant decreasing in their adherence to their treatment plans. When the Affordable Care Act was enacted in 2010, one of the main focuses of the sweeping legislature was eliminating cost sharing for preventative health visits. Cost sharing, or the balance of what is paid by the patient and what is paid by the insurance company, is considered to be a hindering factor for those who need treatment. Cost sharing practices currently affect the most vulnerable of our populations, because the cost sharing for patients of low socioeconomic status is too high to be regularly attainable. The Affordable Care Act mandated prevention visits to be covered by insurance companies at 100%. My solution would be to enable more accessibility to healthcare by eliminating all cost sharing between insurance companies and patients altogether. This would mean that all healthcare plans would have to cover 100% for all services rendered, including co-payments and annual deductibles. If patients were assured that they would not be hit with costly out-of-pocket expenses, more patients would seek services for ailments before extreme damage or extreme detrimental health or expensive health problems would arise. The only way to get insurance companies to cover it at 100% would be to establish legislation that forced them to do this. Because insurance companies are for-profit entities, they are required to do everything in their power to make money. Because of their fiduciary responsibilities, their fiduciary obligation to their stockholders to make as much money as possible, it is highly unlikely that insurance companies will cover a higher percent of fees without legislation. Legislation that mandates the elimination of cost sharing would not only increase accessibility to health coverage overall, but would also drive down costs due to more people seeking doctors before disease onset due to higher insurance rates and higher coverage. This solution lowers costs, increases accessibility, and gives everyone a fair shot at living their American dream.